Hello everyone and welcome back to MediInsights. Today we are exploring Abciximab Injection, a powerful medication used in heart care. If you or a loved one is preparing for a cardiac procedure, knowing how this medicine works can give you clarity and confidence. Starting with use of Abciximab Injection. Abciximab Injection is a type of antiplatelet medicine. Doctors usually use it in patients undergoing angioplasty or stent placement. Its main role is to prevent platelets in your blood from clumping together and forming dangerous clots. This greatly reduces the risk of heart attack or complications during and after these heart procedures. Sometimes, it is also used in patients with unstable angina, where blood supply to the heart is at risk. Overall, its goal is simple: to keep blood flowing smoothly and protect your heart. Next, dosage of Abciximab Injection. The dosage of Abciximab Injection is carefully adjusted by your healthcare team. It is usually given directly into a vein as an intravenous bolus dose, followed by a continuous infusion. The timing is crucial, often starting just before angioplasty or stent placement, and continuing for about 12 hours afterward. You should never worry about the exact dose, because it is calculated based on your weight and medical condition, and is always managed in a hospital setting. Next, mechanism of action of Abciximab Injection. Abciximab works by blocking a specific receptor on platelets called GP IIb or IIIa receptor. This receptor normally helps platelets stick together and form clots. By blocking it, Abciximab makes the platelets less sticky, which prevents the clots that can block blood vessels. This action is powerful, immediate, and very effective during heart procedures, when the risk of sudden clotting is highest. Next, side effects of Abciximab Injection. Like every strong medicine, Abciximab can cause side effects. The most common one is bleeding, since it affects clotting. Some people may notice bruising, nosebleeds, or bleeding from the gums. More serious bleeding can occur inside the stomach, intestines, or even the brain, though this is less common. Allergic reactions, low platelet counts, or blood pressure changes can also happen. That is why patients are monitored closely in the hospital while receiving this injection. Next, important advices for using Abciximab Injection. If you are about to receive Abciximab, always share your full medical history with your doctor. Tell them if you have had bleeding problems, recent surgery, stroke, or uncontrolled high blood pressure. Inform your team about any medicines you are taking, especially blood thinners or aspirin. Never stop or continue this injection on your own. It is strictly a hospital-only medicine. After the procedure, follow all advice given by your care team, including watching for unusual bleeding or bruising. That brings us to the end of today's video on Abciximab Injection. I hope you now understand its use, dosage, action, and safety tips. If you found this helpful, don't forget to subscribe to MediInsights and share your thoughts in the comments below. Stay healthy and informed.